The county is reporting a low turnout in teachers getting vaccinated. Coming up, the reasons why the numbers may be low and how it could change. Plus, the big change in CDC guidance at schools and how that would affect in-person learning here in San Diego. And it's that time of year for spring break travelers to arrive here. What local businesses are doing to try to keep everyone safe from the virus.
ABC 10 News at 4 starts now.
The County Office of Education is seeing a low turnout of teachers getting vaccinated. 20% of the vaccine supply is being held for teachers, but it may not be for long. Good afternoon, I'm Kimberly Hunt. And ABC 10 News reporter Jennifer De La Cruz explains why the number of vaccinations may be so low.
On February 27th, about 80,000 K-12 school employees became eligible for vaccines in San Diego County, but fewer than 30,000 have used the state's designated portal to sign up.
We're starting to see demand for appointments decline.
Here's how it works. The Voluntary Employees Benefit Association, or VEBA, sets up appointments. VEBA sent emails to educators to schedule vaccines with UCSD or SHARP. The portal allows the county to see how many people have accessed the site. But Bob Mueller with the Office of Education says there's a flaw in the reporting system. If someone doesn't use the portal and instead gets vaccinated by their own doctor or a pharmacy, the county can't see those numbers.
So if someone goes to Walgreens or CVS or Rite Aid for a vaccination, there's no way to see how many of those people worked at K-12 schools.
So they know about 29,000 people have been vaccinated through the portal, but the number of actual vaccinations could be higher.
The question is how do we know when we're done?
And they can't ask teachers to self-report their vaccinations because of privacy and HIPAA laws.
I doubt that it means that people are choosing not to get vaccinated in high numbers.
The county currently reserves 20% of their vaccine supply for K-12 staff. Mueller says they're now reaching out to all of their districts, charter and private schools, to make sure everyone who wants a vaccine takes advantage of it while it lasts.
As demand starts to wane, UCSD and SHARP have personnel that they've dedicated to this effort, and they're needed other places. And those doses are also needed other places, which is why we want to make sure that we don't miss anyone. We want to get everybody in now.
Jennifer De La Cruz, ABC 10 News.
As Jennifer just mentioned, the county reserves up to 20% of the vaccine supply for teachers, and it's based on demand. If those doses are not being used, they become available for other populations. And Rite Aid says that it's extending its priority COVID-19 vaccine scheduling period for teachers, school staff, as well as child care providers. The company says this is in accordance with a directive from the Biden administration. Exclusive scheduling for educators, school staff, and licensed child care staff will be available this Friday and Saturday, the 19th and 20th. Appointments will also be available the following Friday and Saturday, the 26th and 27th. Those appointments can be made on Rite Aid's website. And the county has now signed on with the state's partnership with Blue Shield to keep rolling out the vaccine. When asked why it took so long, County Supervisor Nathan Fletcher said it did take time to go through the details and make sure the plan would fit what San Diego is doing.
We didn't have the contentiousness that other counties had surrounding this issue. We never received a contract from Blue Shield to sign. And so it wasn't like we didn't reject anything. We just, all parties kind of talking together. And it just came about that the easiest way to memorialize what we've been doing and what we'll be doing moving forward is just an MOU with the state. And again, I don't see any significant changes signing the MOU from what we've been doing.
Fletcher says next week the county expects a 10% increase in the number of vaccine doses that we get here. And here are the latest numbers on coronavirus in the county. 439 new cases reported today, bringing our total now closer to 267,000. And 8 new deaths were reported. More than 3,400 San Diegans have lost their lives to COVID. The CDC could be updating its social distancing guidelines as soon as tomorrow. We're learning that it will be recommending schools follow a 3-foot distance between students rather than 6 feet. ABC 10 News reporter Rena Nakano shows us how this could affect San Diego schools as students return to in-person learning.
According to an administration official, the CDC will recommend schools to enforce a 3-foot social distance between students instead of 6 as early as Friday. The change comes after a study in Massachusetts found no difference of infection rates among masked students who sat 3 feet apart as opposed to 6.
The safest place to be is on the other side of the planet.
UCSD's infectious disease expert Dr. Robert Schooley says, along with distancing, schools must consider air exchange and good masking.
There is nothing in life that's zero risk, and all of this is trying to balance the risks against the benefits, and certainly none of us want to have kids out of school forever.
San Diego Unified School Board President Richard Barrera says the district will not follow the CDC's new 3-foot guidelines come April 12th.
We do not want to try to cram, as many students as we possibly can into a classroom.
The district already has an agreement with the teachers union to have 6-foot distancing with occasional allowance for 5 feet.
In order for a couple of students to be in a class without having to break the class into, separate cohorts, that if we were able to do that at a 5-foot distance rather than a 6-foot distance, we would be able to do that.
Right now, the district is sending forms to parents asking if they wish to send their children back to in-person learning. If more students decide to come back than what can fit into a classroom, the class will have to split into different cohorts.
Are we able to bring students back 4 days a week? Or if we have to split into cohorts, it would probably be like a 2-day a week for one cohort and 2-day a week for the other.
Rena Nakano, ABC 10 News.
The district says for the remainder of the school year, it will follow the 6-foot rule. It may consider the CDC 3-foot guideline in the fall.
Developments today with the AstraZeneca COVID-19 vaccine developed in partnership with Oxford. It was on hold for use in some countries because there were concerns that it may be causing blood clots. But today, the European Union's drug agency said the vaccine could not be linked to an overall increase in the risk of blood clots. The World Health Organization made similar findings. Also today, the U.S. said that it would send 4 million doses of that particular vaccine to Mexico and Canada. AstraZeneca is expected to apply for U.S. authorization in the coming weeks. Now, as more variant cases show up in the United States, doctors worry that we could be on the brink of a 4th surge in coronavirus. Florida, Michigan, and California have the most confirmed cases of that UK variant, and in that order. There's also concern that a new variant in New York City could cause another wave of cases in the Northeast. A total of 17 states are reporting an overall increase in COVID cases from the week before. Meanwhile, vaccinations are also steadily increasing. About 12% of the total U.S. population is now fully vaccinated. It's about 15% if you look at adults, only since children aren't getting the shots yet. Reaching herd immunity requires anywhere between 70 and 90% of the population to be immune to coronavirus. That's according to multiple experts. Vaccine hesitancy is hovering just under 25% when you factor in people who said that they would only take it if they were required to. That's according to the Kaiser Family Foundation. Now, that could further delay the country reaching herd immunity, but there are some simple things that could help.
A trusted person that that influences you. It doesn't have to be a household name. In some cases it may be, but in some cases it's not. It's just someone that you trust and that you know. When you see they've gotten vaccinated through their filter, you're more inclined perhaps maybe to get vaccinated yourself.
Part of Facebook's new vaccine information initiative is getting people to share when they've been vaccinated. There are filters on Instagram and Facebook that you can use to show you've been vaccinated, or you can make a simple post about your experience. Meanwhile, the federal government, states, and even private firms are spending billions on public service messages with vaccine influencers. Everyone from former presidents to hip-hop cartoons. Now, public surveys reveal people value trusted sources the most when it comes to information on COVID.
And then thus in the process, it helps you maybe make a decision like, oh, okay, I see my family and friends getting this on Instagram. I see the authoritative information. I now see where I can actually get the vaccine in my community, maybe right around the block or perhaps the local pharmacy.
This week, Facebook also launched tools to help people sign up for COVID vaccines closest to them. They also added the COVID Information Center to Instagram, linking to sources like the CDC and World Health Organization.
This just in, House lawmakers passed an immigration bill that would create a path to citizenship for more than 2 million undocumented immigrants who were brought to this country as children, often referred to as dreamers. 9 Republicans joined Democrats in favor of the bill. However, Republicans in the Senate have shown resistance to the bill.